Okay, guys. Yeah, so just some highlights on, oh, hang on. Let me pop that over there. Just some highlights on the Sports Medicine Australia conference, which was last month. There were 3 parts to it. There was the CEPA netball symposium, which was a great little 3-hour session. We had the conference proper. I didn't really go to many lectures. I was mainly there as a with a trade display. And then I did a poster presentation, which was really well received. So I just wanted to run through a couple of points that I think are interesting from that event. First of all, at the netball symposium, there was a question from the audience about what does blister education actually look like for netball teams and athletes. And it was a good question, and there was a bit of chatter from the panel about just basic foot hygiene, so managing moisture, basically wearing good socks, washing feet properly. There was a bit of chatter around wearing quality socks, double socking. There was a bit of chatter about educating around hotspots and monitoring hotspots, and a little bit of a noise about appropriate treatment and even ice foot bars after the game. It's kind of not how I would answer how we would educate athletes around blisters. The way I would answer it goes much deeper. I think it's more than hygiene. Yes, sweat management is kind of necessary, so you don't want to have soggy socks on the whole time. If you have the opportunity, then definitely change out of socks. A bit of antiperspirant may help. Research shows it doesn't, but it's not going to hurt. So there's moisture management in terms of foot hygiene. Then there's the hotspots stage and how people intuitively know that we need to catch blisters at the hotspot stage before there's actually a blister. Now, I think this is not that helpful, especially in competitive sport. And the reason is the hotspot stage is relatively subtle and it's relatively brief. And most people wait until they feel a bit of pain. Now, the pain is not the hotspot sensation, the sensation of just generalized warmth in an area. That's actually once the intraepidermal tear has occurred. And, they'll take their sock off and they won't see a blister yet because it takes a little bit of time to fill. And then they'll be really disappointed that later on they see a blister. But so hotspots, there's not going to be many people in a netball game that are going to come off, midway through the game because they've got a hotspot. Certainly runners tend not to because, they don't even have access to the gear that they're going to need to manage it. So I think it's a bit of a, it's a bit of a non-event hotspots. Yes, we do want to get them at the hotspot stage. Does it actually happen in real life? Probably not very often. And first aid is definitely important. We need to put betadine if the skin is breached and a dressing. This all basically ties into infection control, but there's way, way more to it than that in terms of making a blister not feel painful anymore and not get worse as that game or that activity continues. So if it was me, athlete education would look a bit like this. I've discussed cause, and this is important because most people think that blisters are caused by rubbing. Now, they're not caused by rubbing. They're caused by this. This is shear. Now, when you look at shear, it actually looks a lot like rubbing, but my finger is actually not moved on the back of my hand in terms of it's stuck to the same bit of skin. So when we can't see past rubbing, we think, well, okay, well, let's put some tape there, we'll eliminate the rubbing. Well, yes, you will eliminate the rubbing, but you will still see shear going on underneath that tape. And that's why people like me can blister underneath tape or in spite of tape. But also why it helps for some people because we're spreading it over a larger area, so we're reducing it per unit area. So a little bit of education around cause makes them see it's not just about their shoes rubbing their foot. And I think that that's an important thing. I like to tell people that there's more that's predictable about blisters than is unpredictable, because people feel like they have no control over their blister situation because they try the basics of sweat management, you know, shoes that fit properly and the good socks, and yet they can still get blisters. And so they feel that they've done all that they possibly can, and they're just going to happen from time to time. The thing that's predictable about blisters is where you're going to get them. So as soon as you can locate where people have had blisters before, we can isolate the best preventions for the anatomical location and implement them straight away and take them out of the equation. So the predictability about blisters is a really important factor. There's too many people that give in to this perceived inevitability of blisters. It's certainly not the case. Blisters are 100% preventable, every single one of them, if you get the best prevention in place. Now, a lot of times I see, particularly with the runners, is they tend to start with nothing, and then they ramp up their blister prevention efforts as the blister situation gets worse. I say do it in the opposite. So have your best prevention in place at the start, and then if as time goes by you can't use that prevention or that prevention fails, then you can start adding in other things. The reason this falls down is, for example, at the 6-day ultramarathons, swelling is a big issue. And for toe blisters, I generally recommend gel toe sleeves as one of the best ways to prevent blisters. It's just the material undergoes a lot of shear. So if the shear is happening within the material, then it doesn't have to happen in your skin. Now, we generally can't use gel toe protectors after about day 4 because there's just too much swelling. However, we've milked that gel toe protector for all it's worth. We've remained blister free for the first 4 days. Because we've had that best prevention in place right from the get-go, rather than starting and on day 1.5, day 2, we've got a blister and we're going just basically for blister treatment after that. And the reason I say it's important to use, like, milk the gel toe protector for all it's worth is because the gel is occlusive. You can't really use that directly on a blister. And in some activities like ultramarathon, that occlusiveness with all the sweat, it really increases the chance of maceration. Plus, they don't change their dressings frequently enough. So maceration is a really big risk. And so basically during treatment, I can't even use the best prevention that there is for the majority of toe blisters. So I want to get all I can out of that for as many days as I can. And then if I can't use that anymore, then I'll go to taping or some other prevention that doesn't work quite as well. But at least we've got those first 4 days without blisters. That's just an example of why it's important to start with the best rather than start with nothing or minimal, and then essentially wait until you've got a blister, and then it's, you know, just doing the best you can with dressings and all the rest of it. And the final thing is meaningful blister treatment involves the prevention. Now, blister treatment isn't just first aid, so it's not betadine and a Band-Aid or betadine and a hydrocolloid. That's the first aid part. That's important for infection prevention. However, it doesn't really do much about the shear episodes that's happening in the skin. It doesn't really negate the magnitude of shear deformation. What does that? The prevention. So, for example, the gel toe or the Engo patch or whatever you've got going on, toe socks, whatever. That's the thing that is going to minimize the magnitude of shear deformation in the skin. Is going to mean that that blister won't hurt anymore, or at least it won't hurt as much. And it's going to mean that that blister won't get worse and may even have a chance to start healing, even though that activity continues. So that's what blister education would look like to athletes, in my opinion. And the second thing was around athlete screening. So there was a bit of a session on athlete screening, which was really interesting. And I just wondered whether blisters were being screened for. Can they be screened for? They definitely can be. So what would it look like? It looked like this. Basically, blister history, where have they had blisters before? Now, I do telehealth consults for people with blisters, from like people all around the world. And I send them this and I say, which of these blisters have you had before? And they give me the numbers, and then we go from there. The anatomical site is so important. You've got to start with the anatomical site, and then you nuance it for the activity and other specifics. So this is essentially what blister screening looks like. And it's so easy to do. Show them the picture or just get them to point where on their feet they've had blisters, and you're off to the races. You figure out what the best prevention is for that anatomical site, take it out of the equation by implementing it during every training session, every game, and you won't get that blister. So ask about blister history, and also look for areas of callus if you want to do more than that. And the reason for that is, I think blister history is way more important, and everyone, at least at a high level of sport, they will know their blister history. But if someone is coming in and they're new to this level of activity, and so it's kind of untested, particularly if it's the pre-season, so that their skin has had a bit of a rest from all that shear load, so it's unaccustomed to that shear load, you can additionally look for areas of callus. And the reason this is important is calluses and blisters are caused by the same force, that is repetitive shear deformation in the skin. Calluses are the chronic manifestation of repetitive shear load, where the skin has time to adapt or thicken, and blisters are the acute manifestation, where there's no time for adaptation. So you can think of calluses as an indication that there's high shear load in that skin. As activity ramps up, blisters are very likely. Okay, so then we had the conference. As I said, I didn't actually go to many of the sessions. I had a trade display, and I've got to say, because I was using the Sports Medicine Australia conference as a bit of a because I hadn't done a trade display, so I just wanted to see how it would be received, what worked, blah, 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 before I go to the pod conference next year. And I was blown away at how much interest there was, particularly from the non-podiatry professions. So from the sports doctors, the sports physicians, and the physios and the trainers there. The interest in what's new in blisters and how we can manage blisters better was enormous. Most of them hadn't heard of Engo patches, which is unbelievable, because I could not be nearly as effective at the events that I go to, which are essentially 6-day ultra marathons. I could not be nearly as effective at preventing blisters if I didn't have Engo patches. And the same with gel toe sleeves. Some people hadn't even heard of those. So I just wonder these are the highest levels of sport. These doctors were sort of involved in the highest levels of sport at AFL clubs, etc. And they weren't even aware of these products. So it just makes me think that there's so much better that could be done there. So if you are associated with even grassroots, there's a lot of blister education to be done to the athletes themselves, but also the people that are dealing with the musculoskeletal and skin injuries at the game. So essentially, everyone outside the podiatry profession, they're still firmly entrenched in the rubbing cause of blisters, and therefore they're going straight for taping and compete. That seems to be the most frequently used prevention strategies. So really room for improvement. The penny drop moment that occurred was when I described what shear is. And again, essentially I went, most people think that this is what causes blisters, which is rubbing, but they're actually caused by this, and that is shear. Now, if you look closely, shear looks a lot like rubbing, but there's actually nothing rubbing against the skin here. It's stuck to the same bit of skin. So when we think it's all about rubbing, we want to eliminate that rubbing. So we put some tape there. But unfortunately, although we've eliminated rubbing on the skin, shear still happens underneath that tape, and that's why people like myself can blister in spite of having tape on. Now, if I put a big blob of Vaseline there and I press really hard, what you wouldn't see is big shear deformation like that. What you would see even though if I was pressing really, really hard still, my finger would just slip and slide over the back of my hand. So shear deformation wouldn't build to any degree. And that's because we've made it more slippery. That's basically reducing the coefficient of friction. And that's what we do with Ango patches. So we stick that on the shoe, and I showed them the Ango patch at the back of my heel on the shoe. And the sock is all just nice and slippy slidey over the Ango patch. So this is basically like Vaseline in your shoe, but for 500 Ks, and it stays in place the whole time. Rather than Vaseline and other lubricants, you have to reapply them because they just burst. And I also explained how gel toe protectors work. So I said, if you can see that, that there is shear. Okay, the gel is undergoing shear deformation. Now, if the shear is happening within the gel, less of it has to happen there. So that's why gel toe protectors are so effective at reducing the magnitude of shear deformation in the skin, because the material itself undergoes the shear. And that's essentially the spiel that I gave the sports docs and everyone there that came up to my stall. And yeah, you could see that they were getting it. So yeah, it's all about the cause. We're a little bit off track with cause just generally as a population. We've got the wrong end of the stick. It's not rubbing, it's shear, and that makes a big difference in terms of how we get effective prevention. And thirdly was the poster presentation. Now, I have A4 copies of this as a PDF, so if you want a copy of this, you can just email me and I'll send you one. But I'm going to go through it bit by bit. The established blister causation paradigm of heat, moisture, and friction, it seems intuitive in that the exercising foot gets hotter, that's the heat. This creates sweat, which is the moisture. And this moisture causes the shoe or the sock to rub against the skin, which is friction. However, this interpretation is incorrect. Increased friction does not cause more rubbing. It causes less rubbing. The two contrasting definitions of friction are to blame here. Rubbing versus the resistance to rubbing. They're two completely different. They're in fact opposite definitions for the same word, and that's where we're getting tripped up. In the heat, moisture, friction paradigm, we all think about rubbing. It should actually be the resistance to rubbing. It's how sticky things are. Therefore, this paradigm should be abandoned as it is misleading. Indeed, it is an oversimplification of the real process, ignoring fundamental elements of the blister injury, for example, bone movement. There is a movement force associated with friction blisters, but it is not something rubbing the skin surface. The movement is coming from the bones within the foot. So important. So to demonstrate this, the movement force that leads to blister formation comes from within the foot, from the bones. As the bone moves, friction force resists this movement at every material interface, keeping the skin surface stationary, a necessity for efficient gait. This mismatch in movement between skin and bone is taken up by the soft tissues undergoing shear deformation. The cells and their connections stretch and distort. Of all the tissue layers between skin and bone, now the skin surface is here. So we've got the shoe surface, like the insole. Let's pretend this is like underneath the metatarsal head. You've got the shoe here, the sock here, epidermis, and then the dermis is here, and then way further up is the bone. Of all the tissue layers between skin and bone, the deepest section of the stratum spinosum, here where that blue bit is the weak point to repetitive shear deformation. This mechanical failure heralding the initiation of the blister injury occurs here. Desmosomes, which are these little green dots here, are the connectors between the cells. They fracture, causing skin cells to die. The void created slowly fills with fluid, that's the blue bit, over 2 hours. That's how blisters occur. So it's the bone moving up here, bones moving back and forth, and all of this stretches and distorts. It has been known that friction blisters are caused by repetitive shear deformation since 1955 with the work of Naylor, 1966 Sulzberger, and certainly since 1973 from the work of Kamaish. However, this fact has been lost in translation due to the friction definition issue. So as the message is filtered down, it's things have gone a bit haywire. So this is how blisters form. The bones move within the foot with every step that we take. That's normal. The skin surface does not immediately follow due to friction force. Soft tissues in between the skin surface and bone stretch and distort. That's what shear is. When shear is excessive in frequency and or magnitude, a tear occurs under the skin surface. The desmosomes that hold skin cells together at the stratum spinosum fatigue and break, and the skin cells die. So that is the intraepidermal tear, the tear that happens within the epidermis. Fluid fills the injured area, causing the skin surface to bubble up, which is what we know and love as a blister. Why is this important? Simply because cause informs prevention and treatment, really. Understanding the determinants of repetitive shear deformation opens up previously ignored opportunities for blister prevention, such as bone movement and treatment, and helps identify the limitation of modalities in popular use, like how I described for taping. So this chart is essentially the mechanism of how every blister prevention strategy works. So here in the purple, we've got reduced the number of shear repetitions. That just means walking or running less, taking less steps. Not particularly helpful in athletic situations. This one is all about increasing the skin's resilience to shear. So this is what happens as we load the skin. So let's say as pre-season starts, we've had a rest period, the skin's had a rest period, so it's not toughened up as much as it can be to repetitive shear load. However, as we go through that activity, as the days or weeks progress, the skin becomes more and more resistant to shear. But that resistance tops out at a certain point. So for many, many people, that alone is not going to be enough to keep them blister-free. So the important things here are a gradual increase in the like the training, like the workload or the work applied to the skin, a familiarity with the footwear as well. And then in the middle, we've got how most blister preventions work is they reduce the magnitude of shear distortions. So big magnitude or little magnitude, yeah? First of all, we've got reduced friction force. Now, friction force is determined by pressure and coefficient of friction. So we know what pressure is. Coefficient of friction is just pairing two materials that together are more slippery over one another or more sticky. The harder we press two things together, the higher the friction force. And you can tell that, like the more I press with my finger on the back of my hand, the larger the shear distortion. The lighter I press, the sooner my fingertip just rubs across the back of my hand. And in terms of the coefficient of friction, obviously, like with the Vaseline, you can press really hard, but if it's all slippery, there won't be very high magnitude of shear occur in the back of my hand there. So that's friction force. Then we can use materials to absorb shear, like the gel toe sleeves. We can use materials to spread shear load, which is taping, and then we can reduce bone movement if that is applicable. So clawed toes or hammer toes, flattening of the arch in ligamentous laxity, that kind of thing. And you may have already seen this before because we've published this a couple of months ago, but this is a really helpful video that just explains Doug Ritchie's and my first paper in pictures, basically. Makes it easy to understand. Really good video. Okay, let's get on to Q&A. Claire had a good question. I'd like to increase my knowledge of when to debride a blister or let them reabsorb. Essentially, so I think when you say debride, I'm taking that as meaning de-roof. So I generally would not de-roof blisters unless it was very mucky under there and I had to clear it out, clear the dirt out and stuff. Or if the blister roof was kind of hanging on by a thread, then I'd probably de-roof it because it's more or less de-roofed anyway. Otherwise, I tend not to de-roof. I often lance blisters mainly because at the events that I'm at, it's going to pop on its own within the shoe, within a dirty environment. So I'd rather take the bull by the horns, lance it in a nice clean way, betadine, dressing, implement the best prevention so that blister's not going to get worse as they continue, and educate them on how often they should be changing the dressing. So lancing I often do, but on the whole, you would probably, if you could get away with it, you wouldn't lance a blister. You would just let it reabsorb. Let's say, for example, you were on holiday and you went for a big walk and you got a blister at the back of your heel. If you were still on holiday for the next week, you could just wear scuffs or bare feet or thongs or something, and there's no additional shear to that area, and you could just let that back of heel blister reabsorb. However, we did, Claire, a big session, like a full session on this exact question. So if you head over to the replay from just over a year ago, we went through some specific examples. I could put up a picture of a blister and a potential scenario, and we looked at all the options there. So to find the replays, go to pro.blisterprevention.com, head over to the Learn tab. If you click that little arrow there, it will drop down with office hours replays. Bronwyn asks, why is there so much poor advice about blister prevention? I think, Bronwyn, it's because this conflicting double meaning of friction. I think that is the root cause, because everything centres generally around rubbing. Rather than the fact that friction keeps things stuck together for longer, and encouraging rubbing with like the lubricant or the Engo patch actually reduces the magnitude of shear deformation. So I think that is the cause of so much unhelpful advice. Anurag asks prevention. Anurag, this basically spells out exactly how I approach blister management or blister prevention. I go through this in my head for every single blister that I encounter. If you've got a specific question that you want to ask, then feel free to pop it in the questions or in the message thing, and I'll get to it at the end, or ask it for next month and I'll be able to answer it fully. Ellen asks how to treat and keep your patient playing through competition. The key factor here is implementing the prevention while you're treating it. So you've got your first aid component, which is just a bit of skin protection, because that skin of the blister has lost its base of support. And there is infection prevention, which is your betadine, plus your blister prevention. That is the thing that gets rid of or reduces the magnitude of the shear that is occurring within the skin. So depending on where on the foot it is, essentially my approach to blister prevention is it's essentially, and this is really generalizing it, it's the gel toe protectors for most toe blisters and it's Engo patches for everywhere else. They're the two main things. Now I might do additional taping or donut pad, but they're not as effective as these two things in my opinion. But whatever it is, you just get your best prevention and implement at the time of treatment that is going to make the blister less painful, and it's going to mean that that blister won't get worse as they continue to play or partake in that activity, and may even have an opportunity to start healing. It's so important if you're treating athletes. Angelica, best dressing to apply post-blister. Well, as far as dressings go, it's essentially an island dressing, can go on any blister, whether the roof is intact, torn or de-roofed. Or for a de-roofed blister, you can pop a hydrocolloid on. Don't put a hydrocolloid on an intact or a torn blister because they're very adhesive, and as you pull the hydrocolloid off, it's likely to take the whole blister roof off and you'll end up with a worse blister situation. But I would suggest that the best dressing is not the key factor. So whatever dressing you apply, go for it. It's important for first aid. That is a bit of skin protection for the blister roof that has lost its deeper support and infection control. But the main relief that you're going to be able to provide is the prevention at the time of treatment. Just finishing off, if you need to have a look at the replays, head over to pro.blisterprevention, head over to learn, and you'll see the drop down for office hours. So guys, that's it. Is there any questions that I can answer?
Thanks, Rebecca. That was really good. I appreciated that.
No worries. Any questions? Anything you want me to expand on?
No. You answered my question before I even before you even read my question. Prevention is better than having to worry about curing. I see a lot of footballers in my clinic and a few runners, and that's always been a big thing. And the blister socks seem to help some and not others. And I just wanted to do something better for them. Yes.
Yeah.
So
absolutely. So yeah, you're right. The prevention is important at treatment, which begs the question, let's just get the best prevention in place and we could not even have that blister to start with. So yeah,
yes,
it's very
thank you.
That's right. And yeah. Ellen's keyboard's not working. Okay. Well, if you've got a question, Ellen, feel free to get in touch after this call and I'll be happy to answer it. All right, guys. Well, if that's all, I'll finish up. And if you've got any questions in the meantime, I'm always available. Oh, toe cap with weave or just gel. You're back. I would say, well, I tend to like these ones with the, I don't know what that material is, to be honest. I tend not to go for the fully gel ones. So gel on the inside and on the outside. If I can, the gel is occlusive. So if I can use something that's not so occlusive where I can get away with it, then that's what I do. So yeah, I think I'm just trying to avoid the occlusiveness of it. The occlusiveness of the gel, I mean, the gel is just the best material and I just can't go past it. But the occlusive nature of it does have its downsides, and I don't use these as part of treatment. And if I do, it might just be for a blister that is intact, a blister roof that is intact and is not weeping. Therefore, I know that I'm not getting additional moisture in there. But yeah, the maceration issue can be problematic. But, you know, you'll probably get away with the ones that are gel inside and out. What would be really cool is if you could get this material where it had this cottony material or lycra or whatever it is on the inside and the outside. That would just be amazing. Like how they have for the bunion shields. Sometimes the gel is in a pocket of the material, and so the occlusiveness of it is not quite so important because the sweat can evaporate, or sorry, can move through the material to the outer and therefore be able to evaporate into the shoe. Where can we get the patches? Can you turn it inside out? Yes, you can turn this inside out and it would still work, the gel. Yep. Where can you get the patches? You can get them from my website, which is blister-prevention.com. We have a wholesale program as well. So you can apply for wholesale. There's a minimum order to be able to get wholesale prices, which is $300. But you can head over to Earn. If you go to the Earn tab on the pro.blisterprevention, if you click that little arrow, it will say wholesale. So you can apply for wholesale there. You can also get them from Brigitte, and you can also get them from Club Warehouse. So if you are associated with a sports team, it's more than likely they have a Club Warehouse account, and so the team can be ordering through them. Socks. Which ones do you like the most? Toe socks are good in that they add additional cushioning in between the toes when normally there's nothing. It's just skin on skin. They add additional moisture management and also a double sock mechanism between the toes. However, they are quite bulky. So if you think about it, when you wear a sock over your foot, you are adding 2 layers of sock. If you think about the toe box, you've got sock on the outside and on the lateral and the medial side. Now, if you wear toe socks, you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 layers of sock. So additional 8 layers of sock in the toe box. Now, there's a finite amount of room in the toe box of a shoe. Then if you add swelling, it can become really tight in there. So yes, I do like toe socks. They are probably a step down from the gels. The gels, though, these are quite bulky in themselves, and you can't afford to have one on each toe. It just won't work. They're too thick. So if you need just one toe to be protected, I definitely go for a gel toe sleeve or cap. If you need just general interdigital protection, I would start with the toe socks, definitely. Other than that, in terms of socks, what we know is that a thick sock works better than a thin sock. However, this was comparing 100% acrylic to 100% cotton. This research was done by Doug Ritchie and Kirk Herring back in the early 1990s, where when the 2 socks were very thin, neither was better than the other. When the 2 socks were very thick, they found that the 100% acrylic sock worked way better. And they put that down to moisture wicking must needs the thickness to be able to work, but it could also be it cushions more. And also it could be that the acrylic fibres, in terms of how they're knitted together, that also could undergo a bit of shear as well. So thick works better. Having said that, a lot of people prefer thin, and I would just, and also you can't get 100% acrylic socks. So it's not directly transferable to the real world, but it's something to be aware of. I tend to let people decide on whatever sock feels most comfortable to them, and then go for something more effective. There's more effective preventions than any sock there is. Moisture wicking is purported to happen with acrylic socks, but also wool socks purport to wick moisture. Now, moisture wicking is a theoretical concept that's been shown to occur in the laboratory, but it hasn't been shown, well, hasn't been tested, to my knowledge, in shoe. So it's easy to see that depending on how sweaty you are, how long you got your sock on for, the climate, etc., it's easy to see that the moisture capacity of the sock is exceeded at some point, and moisture wicking simply can't occur to any degree. And with discussions with Doug Ritchie, he really wonders whether moisture wicking happens to any great degree, and he has an inkling that wool probably works better than the synthetic fibres. But we don't have the research to say one way or the other. Ellen asked, in gingy, creepers, anything else? I have patients that toe socks and then normal socks on top. Yeah, okay. So at the 2004 edition of the 6-day ultra marathon, Australian 6-day ultra, I was surprised at how many people were wearing creepers socks rather than the Injinji. So toe socks are quite popular at ultra marathon. And the difference between Injinji and creepers is essentially creepers are a merino sock rather than Injinji they have one that has a bit of wool in it, but they are essentially mainly synthetic socks. And people are liking, well, these runners are liking the wool better than the synthetic. And when I think about toe socks, it always amuses me how people think that toe socks are the answer to all blisters, including arch blisters, heel blisters. Well, really, they're no different to any sock. The only blisters that toe socks can help is interdigital blisters and maybe even pinch blisters. But blisters on the tip of the toe, same as any other sock. Blisters on the top of the toe, same as any other sock. So it's really just blisters between the toe. I have patients that have toe socks and then the normal sock on top. So when you put a normal sock on the top, essentially you've got a double sock for everywhere. You've got double sock between here because of the toe socks. Plus you've got a double sock on the top of the toes, underneath, tip of the toe, and the rest of the foot as well. And a double socks are a coefficient of friction management strategy. Do they work better than Engo patches? I wouldn't think so. Do they work better than lubricants? I wouldn't think so, but we don't know because, you know, the research hasn't been done. The thing about moisture, when we think about preventions that reduce the coefficient of friction or make it more slippery, just because, so that would include Engo patches, lubricants, powders, moisture wicking socks, double socks. They don't all work the same or to the same degree. I feel that the Engo patches work the best, then lubricants. Research shows that powders don't work, but Blister Shield powder hasn't been tested as much as the others. Then the difference there is that is not moisture absorbing, it is moisture repelling, and it's like a PTFE material. So it works a bit different than your cornstarch and talc powders, which are moisture absorbing. But research shows powders don't work. Moisture wicking socks and double socks. So that is essentially making it more slippery over the whole foot. Now, you don't really want to make it more slippery over the whole foot because the foot needs traction in the shoe for efficient gait. So really, when we're reducing the coefficient of friction, we only want to spot do that. We just want to do it at the area that's at risk of blistering or that is blistered. And let's leave friction high everywhere else, because friction isn't bad. Friction's only bad, when it's causing blisters, essentially. Otherwise, we want friction to remain unchanged. So when you think about Engo patches, you just pop them in where you need it, and you're dealing with friction in the best way possible and leaving friction levels elsewhere unaffected, thereby encouraging normal traction for the foot in the shoe. Moisture wicking socks and double socks, that's reducing friction over the whole foot, which isn't ideal. However, to my way of thinking, they don't actually reduce friction that much, and that's why we get away with it without any potential issues in terms of gait efficiency, particularly once we start to sweat a little bit. So that's my thinking. Good questions, Ellen. Really good. Nothing else to add? Nothing else, Angelica?
No, thank you. I was just I use sometimes the Stegen socks with some of my people that run, and the footballers. These people don't suffer terrible blisters, but just something to keep them a little bit more comfortable should they. And that's apparently a very good sock. I don't know because I don't wear them. I just sell them.
Yeah.
But,
I find the Stegen are they're quite thin, and I find they're a bit slipperier than other socks.
You think so?
Which is like a coefficient of friction strategy. So yeah, but we really need some research on comparing socks and seeing what coefficient of friction is for each sock and for varying levels of moisture within the sock. That would be really interesting. They've done some lab tests on 4 materials: Engo, Spenco, Plastazote, and Poron. And they did it for 0% moisture, so completely dry, up to 100% moisture, so basically waterlogged. And the Engo patches reduced the friction level the most, so it was at about 0.2, and it remained at 0.2 whether it was dry or moist or anywhere in between, which is really it's massive. Because most materials don't.
Extremely significant.
Yeah, all the others were around about 0.4, 0.8, that sort of area, and they generally trended to increased coefficient of friction as the moisture level increased. Mm.
Rebecca, just another question. I may have missed it in my mucking around in the beginning, but are you sending? I was particularly interested in the chart that you have with all your blister points. Can we have access to that on your site as well?
Yeah. Let me just. Do you mean? Oh, where am I?
You said when the patient walks into the room, you should always check where the blisters are, and you had a chart with all black
Oh,
markers for blister sites.
that one.
That one. Yeah, that's really cool.
Yeah, I can take a screenshot of that. Or have you got a screenshot?
Yep, I can
Yeah.
do that. I was going to ask if that's
Mm.
okay.
Yeah, definitely.
Great. Thanks. We get a little bit precious sometimes, and
No,
I don't
it's
know
great.
whether to or not copy other people's work, but
Yeah,
got you
no,
now.
I think it's a great idea. Definitely.
Great. Thank you so much. That was it for me. My next patient is actually at 1:00.
Okay.
So thank you so much for making taking the extra time with us.
Yeah, no problems. Thanks for joining, Angelica.
Okay, thanks. Goodbye, Ellen. I've got to get going.
All right. See you guys.
Sorry, Rebecca. Bye-bye.
All right. See you.